Welcome to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm here with my wife, Betsy Ronel, talking about health, beauty, plastic surgery, interesting people in Santa Fe, and so forth. And I wanted to thank our generous sponsors, Suniva Medical, the makers of Artifil, and iFlow, the makers of the OnQ Pain Pump.
And I want to thank the Santa Fean, the current issue of the Santa Fean, the April-May issue with Valerie Plame, a wonderful person, on the cover. They have featured my husband as one of the Santa Feans making a difference. So it's a fabulous, huge, full-page picture of him.
For those of you watching
for those of you on YouTube, right?
Totally.
And, you know, a nice little snippet on what he wrote. So thank you, Devin Jackson. It's a really great piece of work there, and we appreciate it. Everybody go out and buy this month's issue, this current issue, April-May of Santa Fe. Okay.
And don't forget that this month is one of our Vanity for Charity months. I extended it for 1 week in April.
Because of the spring breaks.
Yeah, and you know, the Botox and the fillers are discounted about 20% to get people in the door, and all the profits are going to a local small nonprofit school. So,
and the woman who runs and owns the school funds this thing like you've never seen. It's all based on government grants. I don't even know the full details, but it's, I mean, I can't even put words to it, although I should be able to. I cannot. It's an outstanding small school that serves so many different kinds of Santa Feans and serves them very well. And our children happen to be fortunate enough to go to this school. And I thank God every day that we are at this school, because it has changed our lives, it's changed our outlooks, and it's an outstanding place. I only wish you would let us announce its name on the radio, but if you're listening, woman, you know who you are, and we love the school. Okay. So everybody come on in. It's a wonderful school, and it really serves a variety of Santa Feans.
Betsy is
amazed.
Dying to talk about an article that she
read
in Allure.
Wait, I'm going to start it off with this. Daniel,
yes.
What do you make of this quote?
Okay.
Youth is nimble, age is lame. From your favorite person, Shakespeare.
No, he nailed it on the head. That's why, you know, I practice, and that's why there's such a huge industry, multi-billion, trillion-dollar industry, because people like to look good. Age is lame, as Shakespeare said. And we, you know, I'm concerned because we keep talking about the same thing. But
this is your life's work, man.
This
is it. And there's always something new coming up. I mean, every month Allure has something. Every month Elle, Vogue. Every week these, you know, talk shows or celebrity gossip channels on TV, they all have some new gimmick, whether it's, you know, legitimate or not, that they're talking about. So, dude, you have a very apropos conversation here.
Yes. All right. Let's speak of it.
So let's start it off. So there are many aspects of keeping yourself looking young. As we all know, the surgical aspects, and nothing they say, and the doctor will back me up on this, I'm sure, will ever replace a true facelift, a surgical facelift. All dermatologists will say that. Anybody will tell you there's nothing that replaces a true facelift. But the goal is to sort of stave off the surgical facelift by plastic surgeons now, as well as dermatologists. And it's through other means. What are those other means?
You know, we've talked about them before. Non-surgical facelifts with fillers. They're eating right, using the right products on your skin, skin tightening lasers. That's a technology that is still evolving. There are some really good ones out there, but there are some bad ones out there.
Right, so be very careful.
Yeah, you have to be very careful to whom you go for that. And there are always new modalities coming down the pipeline. Basically, they're all energy modalities, like applying energy to the collagen so it shrinks. And there's only so far you can go with that before you burn something.
Right.
So there's going to be a limit to that. As Betsy said, you can never achieve the same as you can with tightening surgically something.
Right.
But you could probably get 20 to 30% of the facelift result with a combination of fillers and lasers and proper skin care.
Right, and starting perhaps, is it starting earlier?
Yeah, I think the earlier you start and the less damage the skin becomes with proper protection and with, you know, repositioning it in the right place, then the more youthful you will look for a long time. even with facelifts, I still use lasers and
Of course.
fillers and things like that. It's just to make the results look better.
Right. Where on the body or face specifically do the first signs of aging show up?
That's a very good question. It's individualized, but the hands
Oh,
are,
really?
yes, the hands are a very, very telltale sign
see.
of aging, and so many people pay attention to the faces because you can hide your hands in your pocket, but in fact the hands are the #1 place. On the face, again, although it's individualized, in general the eyes are
thin skin, right?
Yeah, it's thin skin. It's also the muscles around the eye. The orbicularis muscle is so active. So around the eyes, around the mouth is also another area that gets wrinkles quickly. And in fact, those are the areas that are being targeted for the minimally invasive or the non-surgical techniques these days, because if you rejuvenate the eyes, the mouth, then you can look much younger without having to undergo a big deal like a facelift.
Right. Although these days facelifts aren't as big a deal as they once were.
That's correct.
You know, still, I'm not, you know, I don't want my face lifted just yet.
No,
but I got my face chock full of filler. That's for darn sure.
Right, and I still see people in their 60s and 70s who come to me, you know, for a facelift consultation, and it has taken them such a big step to get there because they're dreading their recovery time, and they think it's going to be such a big deal. And when I tell them about the modern facelift, they're like, "Oh my God, I wish I was here 10 years ago."
Right. I mean, there's a quote in here, and it's funny because all this media ties into itself. It says here, we may be able to prevent aging right from the start, so your skin can be 29 forever.
Right.
I personally don't need to look 29 for the rest of my life. When I'm 60, I want to look maybe 50.
Right, but how that's going to happen is with stem cells and all the
your platelet stuff that you love.
all the corollaries of stem cells, and that technology is just coming now to the prime time, and it's actually not ready for prime time.
Right.
You can throw stem cells into different creams and mixtures and products, and who knows if they work.
Right.
So we still need to do a lot of research on that. And stem cells may not be the answer. It may be something within stem cells that is the true essence of what they do, and that's what we're going to eventually figure out.
Which is why it's the never-ending story, as Gino so appropriately called it.
Right, Gino, our producer.
But, yeah, I mean, in here, they have something called, in this article, in the current issue of Allure, they have something called the Time Warp, and it shows famous faces from 9 or 10 years ago, and it's really something. I was watching one of the shows this past week, you know, one of these Entertainment Tonight type shows that I love to watch, and they pointed out Demi Moore. I mean, she's just naturally beautiful. I mean, she's just made that way, so she's probably not going to age badly just by the way she's formed genetically.
Right.
But somebody said she actually looks better now than she did 10 or 15 years ago.
Mm-hmm.
She looks great now, just as she did back then. But I see their point. The woman is not aging.
No, actually her face is much more defined now.
Which I like. I think that's very attractive.
Yeah, it's much more individualized. When you see what she looked like 20 years ago, she
was young and plump, and like everyone was.
Right. And she didn't look as chiseled and as statuesque as she does now.
Right.
Anyway,
Okay, we have to take a break.
We're being told to wrap it up.
Okay.
So this is Dr. Ronel with Betsy Ronel. You're listening to the Humanity Behind the Vanity on Talk 1260 KTRC. We'll be right back.
Perfect.